On January 19th of this year, Mark Cuban launched his Cost Plus drug company. The well-known Shark Tank and Dallas Mavericks owner released this online retailer in order to shield customers from inflated drug prices, which highlights a need for price transparency in the pharmaceutical world. Leslie Boyer, a researcher at the University of Arizona, was on a team to create one of the leading anti-venom prescriptions. She performed a cost analysis of the retail price versus the manufacturing costs required for this anti-venom. The retail price is $14,624 and is divided down as $1,000 in hospital earnings, $1,500 to the licensee, $310 in FDA fees, $250 to the hospital's wholesaler, $1,000 to regulatory office, marketing, and legal costs for the manufacturer, $300 for clinical trials, and the remaining $10,000 is to the hospital as well. The actual cost for each individual vial, $14, with a production quantity of 500,000 vials. This translates down into $3 for storage, $9 for manufacturing, $1 for animal care and plasma used in the antivenom, and the other $1 for other costs, including the venom. This 1,000% markup shows the importance of price transparency and the hidden costs associated with the retail price of the medications. This info is not generally accessible to the public, and Boyer was privy to this information from her position at the University of Arizona. Although price transparency does not necessarily mean lower costs, it does create an informed audience and shows areas that might need to warrant change or government regulation. Insurance, Medicare, and Medicaid often cover a lot of the prices of medications in the United States. However, these are accompanied with out-of-pocket costs. Although these out-of-pocket costs are low, the individual still is paying for their medications. Due to their position, insurance, Medicare, Medicaid, they will be able to advocate for price reductions and offer substitutes available to the individual that the individual might not have known about on their own. This increases competition and allows for more pricing decreases in the long run. This general public relies on this intermediary, although many people do not have access to insurance or choose to be uninsured, and therefore must pay the higher costs. Another concept associated with price transparency is differential pricing. This means that drugs are priced in relation to their country's income. For example, the income in India, the median income is far less than the United States, and therefore the medications sold there are far less than what we would pay here. There are two complications associated with this different pricing in other countries. High income and developed countries often bear the weight of all costs of innovation and departmental costs for the organizations, while the other individuals do not pay for these things, which spreads the cost over less individuals, further hiking all of the prices. Second, illegal sales back into the high income country for profit by people from these lower income countries further limits access to the medications, as well as exploits the manufacturers and retailers who rely on these profits. The best implementation of a price transparency initiative is in the Philippines through their government-mediated access price list. This list is a voluntary disclosure of prices and a voluntary reduction for the incentive of increased market exposure for companies involved. It has increased access to the medications, and as well as an overall price reduction. And off-list competitors have also chosen to match the prices to be able to continue to compete in the market. Finally, although price transparency is not proven to reduce prices, it allows for info and communicates the hidden costs that create increases in prices. This Filipino voluntary disclosure and regulation shows that companies are willing to participate when given an incentive or when increased sales are promised. Finally, Cuban's Cost Plus Drug Company shows the value of an informed consumer and seeks to reduce costs to avoid financial burden on the individuals that rely on these medications. These medications from Cost Plus Drug Company, they have a full disclosure of all of their prices on their website, including the 15% markup and the price that they sell from the wholesaler. This company is new, so we don't know much about their impact yet on the whole market, but forecasts have shown that it is supposed to be good.
This is my audience.